In this video, we're going to take a look at blood typing, and there are a few things we need to understand before we can actually talk about blood typing itself. So first, let's talk about antigens. Red blood cells are going to have these things called antigens on the cell membrane. So we have our red blood cell right here, and these antigens are kind of sticking off the cell membrane, and they're going to kind of identify what the cell is. And there are actually more than 30 different types of antigens. But they're not usually typed, so we're not usually going to look at all of those 30 different antigens. We're only going to do that if a patient is going to need multiple blood transfusions, so if they're receiving blood from multiple different people. A antigens, B antigens, and the Rh factor are going to cause the most vigorous reactions, so those are going to be the antigens that we are typing. So we would look at a red blood cell and we would look for the presence of A antigens, B antigens, and that Rh factor. Now let's talk about antibodies. Antibodies are present whenever a red blood cell lacks an antigen. So if a red blood cell does not have A antigens, it's going to produce anti-A antibodies. And these antibodies, they're going to go attack the A antigens of foreign cells. If a red blood cell does not have B antigens, it's going to produce anti-B antibodies. These anti-B antibodies, they will go attack the B antigens of foreign cells. And likewise, if our red blood cell does not have the Rh factor, it is negative for that Rh factor, it's going to produce anti-Rh antibodies. And these anti-Rh antibodies, they're going to go attack red blood cells that are positive for the Rh factor. So these antibodies, they're going to be present whenever a red blood cell does not have a certain antigen, and they're going to attack the antigens of foreign cells. Agglutination is going to occur when antigens and antibodies are mismatched. So let's say we have a red blood cell right here, and it has A antigens. So what kind of antibodies is it going to be producing? It's going to be producing anti-B antibodies. Well, let's say this person with the A antigens on their red blood cells and these anti-B antibodies, well, they are given blood. They are donated blood. Let's say they lost a lot of blood, and so then now they need a blood transfusion. If you give them blood that has B antigens, let's say here's a person who has a red blood cell with B antigens. Well, in this anti-B antibodies, it's going to come attack this blood cell with the B antigens. And this is going to cause clumping. And the invading cells are going to be destroyed. So we're going to destroy these invading cells, these foreign cells, from the donated blood. Blood transfusion reactions can be fatal, and this is why blood typing is necessary. Blood typing is necessary if you're going to get a blood transfusion of any type, because you don't want those antibodies and those antigens to be mismatched, because those antibodies will attack the antigens and destroy the foreign blood cells. All right, so now let's talk about blood typing. So type A blood is going to have A antigens. This is pretty straightforward. Type A blood has A antigens. Type B blood has B antigens. Type AB blood is going to have both A and B antigens. Type O blood has no antigens. No O. O has no antigens. And then the presence or the lack of the Rh factor is going to determine if a blood type is positive or negative. It's present, positive. If the Rh factor is present, then our blood type is positive. If we lack the Rh factor, there's no Rh factor, then it's negative. Positive, present, no, negative. All right, so now let's look at a chart with our different blood types. So here we have our antigens. So if we have A antigens, if our Rh factor is present, then we are producing anti-B antibodies. Our blood type is A positive because we have that Rh factor present. And these are all the different types of blood that this blood type can accept. So let's look at an example. So let's say we have type A positive blood. So we have A positive. So we have A antigens. That Rh factor is present. So we are producing antibodies for the only thing we don't have. So anti-B antibodies. We have A antigens. We have the Rh factor present. And we have anti-B antibodies because we don't have the B antigen. So the only type of blood that we are going to be attacking is any type B, so B positive or B negative. Type A positive can accept A positive, A negative, O negative, or O positive and O negative. The only types we can't accept is B positive and B negative because those anti-B antibodies would attack those B antigens and would destroy those invading cells. AB positive is going to have A antigens, B antigens. That Rh factor is present. And because it has all three, A, B, and the Rh factor, we're going to have no antibodies. So type AB blood, AB positive blood, can accept any type of blood. Any donor can donate to somebody who has AB positive blood. And that's because we have the A antigen, the B antigen, and we have that Rh factor. So there's nothing that this red blood cell is lacking. There's nothing that it's producing antibodies for. O negative is going to be the universal donor. And that's because it has no antigens. It does not have A antigens. It does not have B antigens. The Rh factor is not present. So all of these antibodies, they have nothing to attack on O negative blood. So somebody with O negative blood can donate to anybody. The only problem is if you have O negative blood, you can only accept from someone else with O negative blood. And that's because since you have no antigens and you do not have the Rh factor, your blood is producing antibodies for all three of those. So if someone with type A blood donates to you, those anti-A antibodies are going to attack the A antigens. If someone with type B blood donates to you, then those anti-B antibodies are going to attack the B antigens on that donated blood. If someone with positive blood donates to you, then your anti-Rh antibodies are going to attack those red blood cells and are going to destroy them. It's going to cause agglutination, clumping. This is going to be very bad. You can find this chart in the description for this video, and I'm really going to encourage you to print it out, take a look at it, study it, make sure you know it really well so you can understand what blood typing is.